Good day, everyone. I am Daniela and Pamplona Mado, and I will be presenting to you about my research. This study is entitled Preparedness and Involvement of Staff Nurses in Shared Governance in Selected Hospitals in Raha City. Shared governance is an innovative and organizational management model based on the principles of partnership, equity, accountability, and ownership. It provides a structural format within an organization through which nurses can express and manage their organization with a high sense of professional autonomy within an organization. So, according to shared governance, nursing requires mutual trust, recognition, and respect among the healthcare team, shared decision making about patient care, and open dialogue among all parties who have interest in and a concern for health outcomes and be involved in its decision making. According to various authors, nurses are not involved in shared governance. In the local setting, there is no existing study if nurses are involved in shared governance. Are nurses prepared to engage in shared governance? Do they understand their role? Do they have the necessary knowledge, skills, and appropriate attitude to be involved in shared governance? What are the factors that contribute to their participation in shared governance? With these questions in mind, the researcher decided to conduct the study. For the objectives of this research, here are the following. First, to determine the personal and work-related characteristics of respondents. Next, to determine the level of preparedness of staff nurses and shared governance in terms of knowledge, skills, and attitude. Next is to determine the level of involvement of staff nurses in shared governance. Next is to determine the relationship between personal and work-related characteristics of nurses and knowledge about shared governance. Next is to determine if there is a significant relationship between personal and work-related characteristics and skills about shared governance. Next is to determine if there is a significant relationship between personal and work-related characteristics and attitude towards shared governance. Furthermore, the study was conducted to determine if there is a significant relationship between personal and work-related characteristics and preparedness in participating in shared governance. Next, to determine if there's a significant relationship between personal and work-related characteristics and involvement in shared governance. Next, to determine if there is a significant relationship between knowledge and involvement in shared governance. Furthermore, the study aims to determine if there is a significant relationship between skills and involvement in shared governance. Next, this study is aimed to determine if there is a significant relationship between attitude and involvement in shared governance. And finally, this study aims to study about the relationship or significant relationship between preparedness and involvement in shared governance. For our conceptual framework, here are the variables in this study. For the antecedent variables, it includes the personal and work-related characteristics. For the personal characteristics, it involved the age, sex, and civil status. For work-related characteristics, it involved the type of hospital, length of service, and number of trainings and seminars attended in shared governance. For the independent variable, this studies about the preparedness of staff nurses in shared governance in terms of knowledge, skills, and right attitude. For the dependent variable, this is about the involvement of staff nurses in shared governance. So this diagram shows the schematic diagram showing the interrelationship of the variables under study. For the methods of this study, the respondents of the study were 165 nurses in selected hospitals in Raw City. This is a descriptive relational study which used a one-shot survey design. The study used a researcher-made questionnaire which was validated by a panel of experts. The data were processed and analyzed using the statistical package for social sciences version 20.0. For description, percent, frequency distribution, and means were utilized. To test for the relationship between and among variables, gamma and Kramer's V were used. For the results of the study, the findings shows that the respondents were 21 to 30 years old, female, single, have less than 3 years experience, works in a private hospital, and have not attended seminars and trainings in shared governance. Overall, the respondents were well prepared in shared governance with 78%. Specifically, they have high knowledge with 78.2%, good skills with 50.3%, and have very favorable attitude in shared governance with 86.1%. Furthermore, the respondents are moderately involved in shared governance with a mean of 2.45%. Only length of experience is found to have a significant relationship with skills. Another findings was that there was also a significant relationship between knowledge and involvement. In conclusion, the respondents are aware of the concepts in shared governance. They have the necessary skills to participate in the organization's operations if given the chance to be involved. With regards to the involvement, some of the respondents were hesitant to participate in the organization's operations, planning, and other activities. Since length of experience is identified to have a positive relationship on skills, this implies that the longer the experience of a person, the better the skills in shared governance. Since knowledge was found to have a negative relationship with involvement, this indicates that one does not have to have a high knowledge to have high involvement in shared governance. For our recommendations, first, it is recommended that seminars and trainings about shared governance should be conducted so that nurses will have formal education about shared governances. Second, since the study found out that the respondents are moderately involved, it is recommended that institutions such as in the hospital or in the academe should foster an environment that would promote participation or involvement of nurses in shared governance. And lastly, since length of experience influences skills in shared governance, it is therefore recommended that nurses should acquire more experience in decision making. Thank you very much. That is the end of my presentation. Once again, this is Daniela and Pamplona Mado, your presenter. Thank you for listening.